Okay, well today is a time of embarrassment for me where I'm admitting all kinds of these new things or things I didn't know about, things I was wrong about and everything like that. For over a decade, one of the things that we recognized is with the bypass, there could be risks of insufficiency or inadequate amounts of vitamins and minerals post-op. So in other words, we know that close to 5% of our young women who are still having their menstrual cycle will get iron deficiency anemia. Okay? And there's a whole topic on that. There's a way to treat it and things like that. And so because of that risk and the worry about bypassing the duodenum, the upper part of the gut where a lot of vitamins and minerals are specially absorbed, I came forward with the general recommendation that you should take more than the usual amount of vitamins and minerals, and I came up with a rough idea recommending 3 multivitamins a day. Okay? And the idea was at the end of 1 year, then our patients would get a blood test, and based on that test, they would adjust their vitamin levels up or down. Now, there's some real-world findings after 10 years of doing that. First of all, most of my patients who I directly told to take 3 vitamins a day were, like you, bad patients. That is, when I told them to take 3, I was lucky to get 1. So if you know your kids are only going to do half of what you tell them, you tell them to do twice of what you want. And patients are notorious for not following doctor's advice. So what we've discovered is that in thousands of blood tests over 10 years, most people have normal vitamin levels. That's the good news. There have been a few people with elevated vitamin A, B6, or a couple of other things, and in those cases, we have told the patients to cut back. And you should get your...
Those are the good patients.
They were. Or they're just unlucky because not everybody who takes 3 a day gets those high levels. But those B6, vitamin A levels, we told people explicitly cut back. You need to cut back, and they have cut back. And they should cut back. And everybody should get your levels once a year. In those 10 years, we have seen some patients with some other abnormalities. Low B12, because that happens in the general population, but we have not found that many. Very few low B12 patients. Maybe 1%, and that's about what's equal in the general population if you just look at everybody. And those patients that have low levels, then we're really excited about treating them with the appropriate amount of B12 supplementation. All right, now lots of research, as you pointed out, has shown that you don't get any credit for taking high amounts of vitamins. In the past, for example, I thought that if a little B12 was good, a lot was better. And many doctors would give their patients shots of B12 because we thought B12 was good for you. Recent research suggests that actually high doses of B12 may actually be harmful. So we now think that you should take the right amount of vitamins and not too much. That the idea of, say, Linus Pauling, who said take 10 grams of vitamin C a day, not a good idea. That the idea of taking huge amounts of vitamin D may not be as helpful as actually going in the sun. That taking huge amounts of B12 or folate, which look good to a lot of researchers and has been the source of millions of dollars of research, B12 and folate supplementation doesn't seem to help. And as I say in a recently published article in the Journal of the American Medical Association, may actually be hurtful. So our recommendations on vitamins is take probably 1 multivitamin a day and measure your blood at the end of 1 year. If everything's perfect, stay there. And don't take the extra high doses of anything unless you talk to me first, and I'll give you the latest research on any individual topic. If you get a wild hair and say, I want to start taking 10 grams of vitamin C a day, call me first, and I'll talk you down.
Can I get Barbara's video?
Yeah.